that the pediatric emergency rooms are overloaded and struggling. We know the service had an impact, was effective. Please bring it back. We need it now. We can't continue like this.
When Vivien Carli was not able to find a clinic to treat her 10-month-old son who had a persistent fever, she was forced to bring him to the emergency room here at Montreal's Children's Hospital. What followed was a 16-hour wait and her son being diagnosed with a mild ear infection, an experience Carli says would have been avoided if the one call, one appointment hotline created last September by the Regional Department of General Medicine was still available.
That completely changed the game on that, where everyone had access to immediate care to see an in-person physician or medical practitioner within hours for non-emergency illnesses.
Patients didn't have to wait a long time. They were able to get timely care for their children.
With more than 45,000 appointments set up through the hotline in its 7 months of operation, Dr. Tran says he saw firsthand how much it helped.
We have seen a lot of doctors participating, not replacing their regular clinic for this system, but adding extra hours to contribute more to the crisis. And it has been a really positive point. Doctors are satisfied, patients are satisfied, and with less emergency visits, the system costs much less as well.
According to the Montreal Children's Hospital, the service was a temporary measure in order to help reduce the strain on the pediatric system that was over capacity at the time, something Carli says hasn't changed.
I personally saw the pressure that the pediatric doctors and nurses are facing with this overload. They can't do their work properly.
Both the Montreal Children's Hospital and Saint Justine Hospital emergency rooms have seen upwards of 100% occupancy rates. The Regional Department of General Medicine tells City News there are no plans to bring back the one call, one appointment hotline, but says hospitals on the island of Montreal are working closely with medical clinics to optimize appointment times for non-emergency health conditions. They add the establishment of the First Line Access Counter, an online service that will allow patients to consult healthcare professionals in a reasonable amount of time, will further assist in helping reduce the pressure of emergency rooms, including pediatric hospitals. The service is expected to be fully functional in Montreal within the next few months and can be accessed through the Government of Quebec's website. The service is only available to those without a family doctor, unlike Carli.
We are taking up the space from urgent situations. And so it's just not okay. But we have nowhere else to go.
Carli, with the support of other parents, has created a petition in order to see the return of the hotline. More than 1,800 have signed so far. In Montreal, Felisha Adam, City News.